Good morning, everyone. Welcome, Marie. Welcome, Anita. Welcome, Nina. Welcome, Torie, to our first Facebook Live feedback sessions. So we've got a couple of live sessions planned. So this is our first one. Welcome and thank you for joining me from Uganda, from Wales, UK, and from London, UK. Sorry. Thank you all. So today, we're just going to have a bit of a discussion about the last Epilepsy Assessment and Management course, the third edition we had in January to March 2022 this year. And you all were part of it. You taught on the training, and we're just here to have a conversation about how the training was and why it was so important for us to have that aspect of patients and carers' perspective on the training. And before we go ahead, my name is Tolu Olaniyan, and I am the founder of Pretola Global Health and Consulting. Torie?
Hello, everybody. Yes, my name is Torie Robinson. I'm based in London in the UK. I'm the founder, CEO of Epilepsy Sparks. And also I have a weekly podcast and a YouTube series called Epilepsy Sparks Insights, where I interview clinicians and researchers who work on the epilepsies.
Nina?
Hi, everyone. I'm Nina Mago, founder of the Purple Bench Initiative, and I'm really glad to be here.
Thank you. Marie?
Good morning, everyone. My name is Marie James, and I'm mum to a 35-year-old son who has tuberous sclerosis complex, live in Wales in the UK, and involved over many years with campaigning and advocacy work.
Thank you. Anita?
Hi, everyone. My name is Anita Mago, and I am the program director of Purple Bench Initiative here in Uganda. I'm also a lead supporter of caregivers because I'm also one of them.
I always say it, and I always say that the EAMC can never be the same, can never be good enough without a parents and patient perspective, carers perspective session on it, because it's so important. And I'm a clinician. I've worked, over the years with families and people with learning disability and epilepsy, but I always find it that it's so important to learn from the families, to work with the patient, or else the care would not be successful. So it's so important that we add that. And every year, every time we have the EAMC, that aspect of the training is one that we always enjoy. We always look forward to it because it's a key part of learning. And we added this year, and you all were, part of that training. You all shared your experience. And really, how did you find it? Marie, it will be your first time of training on the EAMC.
I was absolutely delighted to be invited to join you on the course and to share a little insight really into what life is like for us with tuberous sclerosis complex and demands of care, the ups and downs and the joys as well, because it isn't just negatives. I think if you embrace this life, then there is the joy is different than to maybe what one's journey would be thought of initially. It just takes you on a different course, and the families that we meet along the way have been truly amazing, and the insight that we have is different, I think, nowadays to what it was initially. And to be part of the course was really very important to me, because sharing information is really valuable, because it's a continuous learning curve. Whilst at the start it is quite a steep one, it's an ongoing one, thankfully, because of all the scientific research developments that occurs over the years, and having been involved for 35 years now with different organisations that support our younger son, then it's been quite an eye-opener to see the different things that are available now to what were initially.
Fantastic session, really. I really enjoyed your teaching, sharing about TSC and epilepsy on the training, which we'll come back to. Nina, how did you find it? Because we had clinicians from 36 countries, from Asia, from Africa, and a lot, joining in to learn from you on the day.
It was wonderful, really. And it was a step ahead from what it was before. We got a bigger number. I think, Tolu, you can remind us of how many people would be coming or were coming from Uganda. But initially it was just one person. And so for this session to have much more was growth on my end, and a great opportunity to also share with all these people what it's like to live with a condition that they, on the other hand, don't have, but are supposed to help or support people living with. So it was awesome.
That's a very good way of putting in, Nina. And yes, the first EAMC, you had just one clinician from Uganda, and this time you had over 30, if I remember, I think 35 or thereabout from Uganda, which is, imagine 35 clinicians from Uganda joined in to learn 17 topics on the EAMC and also learn from yourselves. Really, really, I know there's still a lot to do, but that is a very good start. So yeah, fantastic. And like you said, clinicians are working to support people with epilepsy, but they don't have the conditions themselves. They don't. Torie, why is it so important that we do this, that we train clinicians, that we support our clinicians to be able to help us better?
It benefits both parties. Actually, I would say three parties. First of all, it, of course, benefits patients themselves. It can be empowering for the individual. We were having a little chat before we went live about how if you work with a patient and carer, you can actually make, for instance, taking a drug kind of fun. I mean, it sounds absolutely crazy, but it can become a little bit fun. And you give that control to the patient and the carer. I wanted to also say that I completely agree with what's already been said about the benefits of what we've done. I completely agree with Nina and Marie. I want to say I'm also aware that largely, and this is global, that many clinicians aren't yet convinced of the importance of listening to patients and listening to carers. Well, we're just like those people down there, down there in the hierarchical structure, and we must do what the clinician tells us. But what is wonderful is that we have had so many people, the EAMC 3 especially, people by meaning clinicians, who actually recognize that it's not solely beneficial for the patient and carer, it's actually beneficial for the clinician and their career, because they're recognizing that if they listen to us, they're going to be able to treat us more effectively, improve our quality of life more effectively, and get a big tick on their, evaluation sheet at the end of the year, because they become more effective doctors, nurses, neurophysiologists, everything. And so it's wonderful to see that. That's my overall thought of what's happened this year.
Thank you. Anita, you are the program director for Purple Bench and also a fantastic mom, mother to our beloved friend, Nina Mago. And really, you shared your journey with us. And how did you find it, being able to share the journey of you as a mother, supporting your daughter to a point where she's blossoming and she's known, globally? She's not just an Uganda treasure. We treasure her here as well. How did you find it, being able to share your story with clinicians?
Oh, thank you very much, Tolu. It was a very interesting and great opportunity to be able to share with the clinicians. And, that was a very special session whereby it brought the three entities together, because there's the clinician, and then there's the caregiver, and then there's the patient, because the trio are important for the healing of the patient. It brought out some of those aspects, like, we as caregivers, we are the ones who are very close to the clinicians, and the clinicians are sort of delineated from the patient, especially if these patients are younger. And it is so disheartening as it came out on the part of the patient, that they are not taken into consideration in the whole discussion when they go to the hospital, because then the clinician is talking to the caregiver. The caregiver is not the one who takes the medication. So we as caregivers have actually been doing what we aren't supposed to do, generally speaking. We've got to give more opportunity to the patient to be relating with a clinician.
Clinicians, yeah.
Yes. And another aspect I thought about was that the clinicians have got to understand that there are myths surrounding this condition of epilepsy. Because if you just give out the medication and then you let the patient go, you find that sometimes the patient will go back home. He or she knows she's supposed to take the medication, say maybe 2 pills 2 times a day. But then there are these myths, like for instance, that there is when the moon is coming out, that they will get a seizure. So they tend to step up their medication. So the clinicians have to be more involved in the patient, and I think that gap that we were trying to talk about to get closed would very, very much help the healing of the patients.
Torie, I don't know if you heard, I recently heard about this moon thing. I'd never heard of it before. Apparently in some countries, I don't want to say Africa alone, because it could be happening in other, low resource countries that we're not aware of. But I heard that there's a myth that people fear that it's when the moon is coming out, that's when they have seizures. But it sounds like a vampire movie, when we watch all this. So that's the thoughts. But I don't know where the myth came, but it's there. But imagine someone that's got that myth going on, and the parents or the siblings believe that. How would you want them to imagine? They will just end up taking loads of medication or overdosing themselves, or not taking it till when the moon is about to come out, and then they won't comply. Which is why it's so important we work with them, we understand it. Torie, go ahead.
I think it's important that we realize if somebody is going to tell you that, the moon's coming out, get ready because you're going to have seizures, you're actually more likely to have seizures because it's really stressful. Yeah. And you're going to worry, and it becomes a self-fulfilling prophecy. That, so if you tell somebody, and it can be anything as crazy as that, or, by the way, if you go down that street, you're going to, it is equally silly, to be honest. If you go down that street, you're going to have a seizure. Then people are much more likely to have seizures and have lower quality of life, by the way. And again, going back to what we were saying, it's not just about the seizures. It's about the anxiety that's caused by that. It's about being scared of the world. And even if we are talking solely about one time of the month, you're going to people will start worrying about other times of the month. Oh my goodness, and then we get into sort of other, made up ideas around the month, around the year, and people get so worried and paranoid about these things, and it makes complete sense. That's how our inner chimp brain works. We seek out dangers so that we can run away from them and hopefully avoid them, and that's what we've done as a species and continue to do as a species. But it's really negative for us and our health, and effectively it literally can impact our likelihood of dying. We could have an injury, we could die of pseudo. So let's not focus on things that are made up. Let's think about what evidence is actually backing up claims like this. That's what we need to tell families, because often Anita was kind of saying, and Marie as well, implying that the family have a really huge impacts on the perceptions of the patients. And that needs to be seen by the clinicians too. Neither party should be saying, watch out that one time of the month. The only time I would say, sometimes look out for the time of the month. Not all of us. I'm not sure about you, Nina, but I can't remember what the term is, but sometimes women will have more seizures around their period or menstruation. I don't experience that, but I know lots of people do. But we can imagine how people easily say, well, watch out, there's a full moon, that's around your menstruation and all these types of things.
You're so funny, because I remember it was week 1 of the training that question was asked. And it was when Dr. Lisk from Sierra Leone, Professor Lisk from Sierra Leone taught and did the overview of epilepsy. That was when that question was asked. I remember it now clearly, when one of the clinicians asked about, there's this myth around the moon, and Professor Lisk,
wow,
who is quite, experienced, a neurologist, has worked in the UK and now working in Sierra Leone and works across West Africa, was like, there's no evidence to it. But those are the things that can hold people back and, can impact on care. But I want to ask Nina a question. And the question I want to ask Nina, remember when in your session, you mentioned about, I think it was during the question and answer bit as well, was when you mentioned about the fact that when you were little, when you and your mom would go and see the doctor, you would be in the waiting room. Your mom would go and see the doctor. No one will speak to you. Afterwards, your mom will come out and they'll just be like, okay, let's go home. You didn't feel that you were part of that, process, because you were not. When did you start to get involved in your care, and how did you find it? What impact did you find it had for you when you started getting involved?
I got involved when I was much older, but the impact it did have was that it covered up the fact that I had this condition, and I didn't get to know that I had it. I was going along with my mother to see this individual who could have easily been her friend. And then there's a little space where I sit and play with all these different things, and then they ask me a few questions like they would ask a child, how are you? I'm fine. And that's it, So it took me a longer time to understand that I had seizures and that I was seeing this particular doctor for that fact. So it's something that that really, really needs to be changed.
When you go involved, when you were now able to be a part of that process, did you find that being able to ask your clinicians questions, being able to actually understand what's going on, really helped you to, with your treatment, comply, take your medication? Okay, now I know I'm taking this medication. Now I know why we would go and see this doctor. Do you think that helped?
It really did, because after seeing the doctor and, now knowing what's going on and getting to the point where I have to go to the doctor on my own, gave me the opportunity to speak for me. Now we can sit down and talk about all these different things that include contraception. I mean, look at a fact that a person is most probably, to some degree, thinking, okay, maybe I could take this medication to help for this. I only found out recently that even when I'm going to take antibiotics, there's some antibiotics that don't work well with my medication.
Yeah.
But you're grown up now and all your friends are taking contraceptives, and then you find out you actually can't. They mess up your medication. How would I have known any of these things, considering the trend of things? It took me having to go to the doctor alone. I told Anita, I'm going alone. You're not coming. This time you're not coming, I'm going alone. And, everything has been so radical for me. And I think Anita would let you know.
I'm going to come back to that bit, because I do want to find out how Anita felt when Nina was like, Mom, stay at home. I'm going alone. Well, I actually want to ask Marie, because Marie, you've got a son, Tristan, that is nonverbal, and he's got complex health needs, not just epilepsy. He's got TSC, and a whole lot of needs that you and your husband and the family really, and the care team that you've built a very good, robust team around him. How do you empower him to engage in his care, in this treatment?
I think it's a fine balance when somebody has intellectual disabilities as regards the information that they're able to process because of their abilities, and also the need to know. Obviously, he takes tablets and he has to have medication regularly. So, as Torie mentioned earlier, we try and make that into a fun activity rather than something that we demand of him. And of course, it's important regarding covert medication and giving medication that he knows, as far as we're able to help him understand that he needs to take medication. So we turn into as fun a routine as possible for him to be able to take. As regards engaging him in appointments, there are some things that we tend not to speak of in front of him because of his abilities. I can remember him getting hold of a video of seizures that we had done over a period, and being quite mortified really that he had hold of the recordings and he was about to see himself having seizures. But that turned out to be a very good experience for him, because he has objects of reference, rather. He has limited communication. So objects of reference is really important to him when we speak and give him choices. So actually seeing a video of himself, he loves watching videos on YouTube, etc., and engages then. So actually seeing a video of himself having a seizure was really quite helpful for him, because we were able to refer, he was able to see what was going on. Thereafter then we used to refer to him having seizures if he was waking up post having one. And I think he had a better understanding of what he had, the episodes that he was just gone through. So that was helpful. So you find ways and means of engaging and trying to help understand without burdening somebody with the negatives around things that potentially they can't change.
And Marie, how important was it for you and your husband to actually understand his care needs, for the clinicians to talk to you, to engage with you, for you both to be able to support him? Because you know his voice, and how important is that to you?
Well, initially, when Tristan was diagnosed back in '87, there was very little understanding of tuberous sclerosis. And we found ourselves very early on being the ones who were informed about the condition, going along to see different consultants at the time and giving them information about the condition. That's hopefully in a majority of cases that has changed, where there is a little bit more understanding these days, and the ability, of course, to look up things easier. More information available, and as I mentioned earlier, scientific research development has come on significantly in the last 30 years, especially in the field of tuberous sclerosis complex. Really, really important to be able to keep informed, because things changed dramatically, and there are always emerging treatments on the horizon. So being aware of what's coming, really important, and also knowing the processes as regards getting access to emerging treatments. I think that's been a huge barrier over the years, and something that we've worked with his clinicians over to try and overcome, so that we have the best possible opportunities of giving him good outcomes. Because it's an evolving situation all the time, and we can't rest on our laurels thinking, right, we've got this sus now and we know what we're doing and this is the way forward. It has to fluctuate according to the information that's to hand, and we're so lucky that there is research into different areas of TSC and epilepsies and autism, because Tristan is autistic as well. So all of those and gel together. The burden of tuberous sclerosis complex associated neuropsychiatric disorders is really heavy, and I think there is a beginning to be a better understanding now, though that there's considerable work to be done in the field to be able to support loved ones like Tristan go through the systems and the processes to get the best possible care.
Thank you, Marie. Anita, so how did you feel when Nina was like, Mom, stay at home? I'm going to go to the doctor myself. I will come back to tell you what the doctor says. How did you find it?
Most of us parents with children who have this condition over time become very protective. But in the course of being protective, we become dependent on the patient. I really appreciate what Mary James is doing for her son, because he's got some other condition, which is she's talked about. But then there are others, some of us who have children with this condition, but they're only suffering basically from this condition. They can speak for themselves. They're going to school and attending school in spite of all the challenges that come with it, you know, discrimination and so on. But you can't imagine that you become, as a parent, you become so dependent on being around your son or your daughter who is able to stand up for himself or herself, and you deny them the opportunity of expression. They tend to be losing their confidence in a way, because they can never take their own decisions. Nina is a very aggressive person. She had to become that, and she's done it on several occasions. She just says, no, I have to do this on my own. And she just says, she won't ask that permission, but she'll inform you that she's going to do it. Now, when she chose to go to the specialist herself concerning her condition, she just said, I'm going alone. Of course, you get shocked, but you've got to give way, because there's even another parent and another who have got grown-ups who are getting to their 30s. They've gone to school, they are graduates, but because there's no support from the clinician, these clinicians have got a big issue. You look after a patient from there when they are still in the pediatrics, when they are still very young, and they grow up, and you still encourage the parent to bring the child to you, who is even a grown-up girl. Adults. Or yeah, you can imagine this young man or woman they have their own challenges, like a teenager growing up, you know, their bodies are going through changes and so on. Maybe she wants to ask, how about if a boyfriend tells me this, or how can I do things which they can't ask when the parent is around. So you sort of bottle them in, and you deny them that expression, and even to explain to the clinician exactly how their bodies are reacting, which they would be ashamed to talk about when you are around. So we have to step back as caregivers.
Thinking about the work you do, Purple Bench in Uganda, how you work with families and carers and patients as well. The importance of actually educating, you know, patients. And we know there's something we call burden of normalcy, where now things are coming to normal, quote unquote, whatever normal is. And then the parents are struggling to let go, because they don't, that's all they've known. They've always taken care of their child. But to support the parents and the carers, the caregivers, as to, they can now take their own decisions now, really, and supporting them to know that giving that adult the space doesn't mean that you don't care. It doesn't mean that you don't care. It just means that you're available. They can always run to you if they need you, but they need to start to work. They need to start to stand on their own 2 feet. And that was why it was so important we did that topic on the EAMC, because to understand where the parents are coming from, to understand where the patients are coming from, and to understand where the clinicians are coming from, which, you know, we really all need to work together to be able to, for the patient, the individual, to be able to live and blossom as much as they can. Torie, the mental health aspect of epilepsy, which was one of the key factors that you talked about, where we know it's not just seizures. It's not just about counting how many seizures, less seizures this month, but what else is going on? Well, how does the individual feel? What else is going on in their lives, in their thoughts, in their day-to-day activities? Torie, do you want to talk about that?
Sure. So often seizures, quite frankly, aren't our priorities. We have epilepsy, yeah, but and I think often, but both with carers, patients, and clinicians, it's often if you're diagnosed with epilepsy, right, seizures is the primary issue. Now, okay, sometimes it is, especially if you are having recurrent refractory epilepsy and you are having several seizures a day, which is very dangerous. But a lot of the time, I hope you don't mind me saying this, Nina, but for people like you and I who have like at least to a degree some control of our epilepsy, we have time to think about what goes on in the rest of our lives and stuff. What can be more important to us is our mental health and how we feel, because you can have all the controlled seizures, like that could be great, but if you feel awful mentally, then there is no point. So it's about quality of life. And I refer to Nina, obviously, but it's the same for your son, Marie. I often feel, and it's important for us to say, what about when people are non-verbal? Because we know that there's a very, very high rate of psychiatric comorbidities in people who tend to be non-verbal and have autism and things like that. What about those people? And how do we figure out how they might be feeling mentally? And then in addition to that, what's the mental health like of the carers too? Again, we come back to like the overall picture. And even if we have a clinician who might be, oh, I don't care about the carer, it's only about my patient. Well, we must realize that the mental health of the carer impacts us as the patient. Even if we have intellectual disability, we have like kind of that sixth sense. We know how our loved ones feel. We feel their pain. In a summary, mental health is absolutely crucial for the quality of life of anybody, including patients with epilepsy. And sometimes, often, in fact, I would say clinicians need to prioritize the patient's mental health and mental stability over the epilepsy. And another reason actually to do that is if we're feeling really anxious and stressed out, we're more likely to have a seizure anyway. So you cannot just say, oh, we're going to sort out those seizures. Part of sorting out those seizures is ensuring that there is some psychiatric stability within your patient. And actually, when we are deciding upon what drug to give a patient, we need to figure out, okay, what is the potential likelihood of that negatively impacting the patient's mental health? Or vice versa, we know that if somebody has access to lamotrigine, that can be seen as a mood stabilizer. But we also know that levetiracetam can sometimes, maybe only 50% of the time, but sometimes can have an impact on a negative impact on the mental health of patients. So we have to be weighing these things up. Again, it's not solely about the seizures, it's about the mental health and quality of life as a whole of the patient and the family.
This year, we did something different. We had a special feature topic, and it was TSC, tuberous sclerosis complex. It was a new topic to a whole lot of clinicians on the training, and there were loads of questions because some of them were like, wow, I've possibly seen someone with this condition without even knowing, because all they were focusing on was the epilepsy aspect, but not actually thinking of the TAND, the neuropsychiatric aspect of it, and the other comorbidities, because it's a systemic condition, really. So it was so important we had Marie James really share with us our experience about the combination of both epilepsy and TSC, having because we know TSC is one of the leading causes of epilepsy, genetic causes of epilepsy. I'm just going to read one of the feedbacks we had after your session, Marie. Someone said, thank you so much for sharing with us the experiences of living with epilepsy and caring for people with epilepsy and TSC. Like now they can now see, okay, we had sessions week 3, your session was on week 6. We had sessions in week 3 around TSC. It was a whole day on TSC and it was great. We had clinicians from South Africa, India, and Belgium teach on TSC. And then on the last week, you now brought it to life. You brought that to life. What do you think, Marie?
It was brilliant, absolutely fantastic to have the opportunity. Raising awareness is so very important for families like mine. And to touch on what Torie said earlier, it has to be a holistic support, really, when you're caring for somebody, and that's why access to specialist services is really important for and clinicians to be able to step back, like we do as parents, to look at what the person needs, and because it's not about our needs, it's about their needs, and what best possible outcomes we can have for loved ones. So whilst it's lives entwined, it's really important to step back as well as far as possible. But we have been in situations where, because Tristan, once he turned 18, was regarded as an adult, where we've been totally ignored on emergency hospital visits, admissions, for instance, where her opinion wasn't counting for anything, and clinicians were taking best interest decisions without involving us, which is quite a scary place to be when you have a lifetime invested of historic information that is valuable to be able to try and pass on. So for us, it's important that we work together with clinicians still to be able to offer best possible care. As regards the tuberous sclerosis complex, whilst there's been significant developments and lots of information and knowledge learned, one of the first epilepsies that affect a youngster, that can affect a baby, are infantile spasms. And it's absolutely heartbreaking that still now, these days, that despite having a diagnosis of TSC, and recognition that there are infantile spasms starting with a baby, that there is not immediate proactive intervention for treatment, because these seizures are a medical emergency, and families are often left for weeks in limbo, waiting for either an appointment or for starting treatment. And for those cases, it is imperative that it is done as soon as possible, so that you can limit or try your very best to limit the damage, the potential damage of developmental delays and lifelong learning opportunities lost and care demands increasing. So important to be proactive on some seizures and to recognise that, and for clinicians to be, even in the UK, more aware of different types of seizures and the potential damage that can be caused. And also avoiding preventable premature death for those with epilepsy. Really very important.
Thank you, Marie. And lastly, some more feedback for us all. Someone said, I have a better understanding of what patients and families go through. Another person said, now I appreciate the struggles of people with epilepsy. Sharing your experiences with us is so humbling. Someone said, it was an educative session and an eye-opener. Another person said, it was great listening to families and warriors. So guys, thank you, everyone. Thank you, Nina. Thank you, Torie. Thank you, Anita. Thank you, Marie. Thank you for connecting. I think it was in the afternoon in Uganda when we had that session, or morning in the UK. Thank you all for sharing that and for educating nearly 300 clinicians from 36 countries about why it's so important to engage with the person, to engage with the families. If we really want to improve the care we deliver in our countries, we can't. It's not possible to deliver good care without engaging with the person. So thank you all so much. And Torie, parting words from you.
Thank you to everybody who not solely attended the course in its entirety, but is also listening here today, because you appreciate the impact, the positive impact that you can have on the lives of patients and carers as a whole. And no doubt you also realise how that impacts society. And everything is positive about that. And please remember that, we're aware that generally we only see the tip of the iceberg of the work that you're doing. We completely appreciate the work that you're doing. Without you, a lot of us would literally be dead. And without you, our qualities of lives would be really quite rubbish. So you mean the world to us. Thank you.
Thank you, Torie. Anita.
It's been really a wonderful experience, sharing from the various parties, from the presenters, and we continue, myself especially, but since we are working with Nina, we continue to use our own experience and the lessons that we are learning to improve the lives of people with this condition whenever we can reach out to them. Thank you so much, Tolu, for putting this together, and we wait for even more.
Many more to come. Thank you.
Yeah, sure.
Okay. Marie.
It's been a fantastic opportunity and an eye opener as well to be to have the privilege of being involved with this and to learn more about epilepsies across many different countries and different care situations and how different countries work as well. So whilst we are all in different countries on different stages of this journey, pushing forwards for better outcomes, really important for everybody, wherever you are. And wonderful to be part of this. So thank you, Tolu, and to everybody who has been involved.
Nina, our warrior.
Thank you, Tolu. I really want to thank everyone who took the time to be a part of this training. To the newly trained medical personnel, you will be really surprised to know that the people that you're going to be talking to are amazing souls. And with you, it will be a great opportunity for them to start to discover themselves. I say that because I have seen it on many occasions, because your first friend is your medical personnel. If you can make friends with your medical personnel, you're on a good road to getting some level of stability, because you not only get the medical, but you also get the mental help that you might need. So keep going. Thank you, Tolu.
As we've said, it's a continuous process of engaging. It's continuous, and it's a continuous process of learning. This is the third time we'll do the EAMC, and I always join on every session myself, apart from, coordinating it and leading it, because I'm still learning, learning a lot, and I learned a lot from your session. Thank you so much. And thank you to all those that have joined us to learn, to watch us today, and those that are watching afterwards. And also, lastly, thank you to our sponsors, Rowe Foundation and TSC Alliance. Without those two organizations, it would have been really difficult to have the EAMC this year, because it was free. All the clinicians joined from all their countries. All they had to do was get themselves start learning, and they learned from some of the best across the world, including yourself. So thank you all for your time and sharing your experience with us. And we're gonna go now. You do have a lovely, lovely day. For us in the UK, it's a long weekend because it's the Golden Jubilee weekend, isn't it, Torie? That's the one.
It is. I can't say I will be going to see the Queen, but I'm like, dude, this is great. More time with my plants. Thanks.
It's more plans with my kids. So have a lovely day, everyone, and see you all soon.